So Derek, please tell us about what doctor says you have done so far in last third quarter and how much money we're going to save next year.
Thank you, Dr. Banzel. That was amazing, very inspirational, and right on target in terms of the opportunity to keep the primary care doctor in charge of the ACO and in charge of healthcare in general. I'd also like to thank Dr. Subodh Agarwal, Dr. Arthur Hansen, Dr. Paul Haver, and also the ACO executive team. It's a real honor to be here. Next slide, please. So we are on track, like Dr. Banzel said, for about $6.6 million in terms of a performance payment to doctors ACO. You can see towards the bottom of the screen. And Medicare benchmarks all of the ACO physicians against themselves during the benchmark year, and half of the doctor's benchmark is based upon risk-adjusted county expenditures. So what that means is that the doctors are now competing with the local community in which the patients reside in terms of saving and efficient use of healthcare dollars. So Doctors ACO has a total ACO benchmark of $128 million. Think of it as your pen as a primary care doctor controls $128 million. This is a $128 million organization. And right now, if we were to end this year, right now, Doctors ACO would save about $9 million. That's a 7% savings rate, and that would end up with a 75% sharing rate and a 98% quality score with a $6.65 million payment to Doctors ACO. Now, the year is not over. This is typically, the holidays, November, particularly December, is a very difficult time for healthcare. It's a very stressful time. Patients' diets, tired family members. There's a lot that can happen this time. And so really, we have 4 weeks left in the year to make the biggest difference. And maybe we can get to that $10 million mark. I think it's realistic if we really buckle down and really follow the ACO programs that we can reach a $10 million mark. Next slide, please. So how do we get to that $9 million in savings? And what I've done is I've broken it down by a pod. So you have the Athens pod, and we have all of the ACO participants on the screen. And you can see in the last column is the savings or loss based upon their historical benchmark combined with the risk-adjusted county expenditures. And we average those out. So you can see the benchmark column and the PMPM minus the benchmark multiplied times the number of patients for savings. And that's the total savings. So you can see Athens has a $6 million contribution on 5,000 patients towards Doctors ACO savings. Next slide. Now we have more than just the Athens pod, the Athens area pod. We also have the Atlanta pod. Next slide, please. There we go, the Atlanta pod savings. So here we have the ACO practice. You can see Atlanta's contributing almost $2 million to the overall ACO savings. I see Dr. Naresh Parikh at the top with $1.77 million in savings. Excellent work. Dr. Parikh is one of the ACO leaders. And you can see right where you stand. And the goal is, and this, you really want to compare yourself to your historical performance. Buying into the ACO programs, buying into the physician outreach program, investing in your practice, extending office hours, all of these crunch time activities are really going to make a big difference for the final. We can get, some of these numbers may be in red, but we can get them in the black and contribute to the overall ACO savings. Next slide, please. So this is the Columbus pod. Columbus is the newest addition to Doctors ACO, and a lot of times the newer practices, it takes some time to get them to buy in and to understand and to really get moving. Like Athens, you can see the Athens pod was saving $6 million. So we're going to turn around the Columbus pod, and there's a lot of opportunity here, but we have to continue working very closely and vigilantly with those practices. Next slide, please. And also, Doctors ACO is across the country, so we also have practices in Ohio and Indiana that are participating. You can see here that the Dayton, Ohio pod has a $1.7 million in savings, and then the Indiana pod has $1.4 million in savings. So excellent work. These are great numbers. Next slide, please. Now, this is a crazy year. What a crazy year. But Medicare is trying to help us out. So Medicare, the Shared Savings Program, has created many flexibilities from telehealth But what I'm going to focus in on is the flexibilities to fight COVID-19. So what's happening is Medicare will remove all Part A and Part B expense for COVID-19 episodes, starting with the month of a hospital admission and then 1 month post-hospital discharge. What does that mean? Well, let's say a patient is admitted to the hospital for COVID-19 in July and discharged in August. So the patient was there maybe the end of July and got discharged in the beginning of August. Medicare will remove all expense for that patient in July, August, and September, and that's removed from ACO calculations. Now, we all use a product, an analytics software called Blue Sky Analytics. Blue Sky Analytics will show you these amounts because there's a filter in the system that will show you where those expenses are. Now, for example, through the third quarter of this year, Medicare has removed about $2.7 million in ACO expense due to COVID-19. So they're trying to help the ACO. So if the ACO got hit really hard with COVID and a lot of admissions and patients, LTACs and ventilators and all types of things, Medicare is going to remove that expense. So they're trying to help. Next slide. So right inside, this is a screenshot of Blue Sky Analytics. If you don't have access to it, talk to Brian or Rochelle or Neil, and we'll get you access to Blue Sky. In the ACO Insights report, we have a filter for COVID-19. So this filter, when applied, will remove all of the expense, just like the Medicare rules. But on the flip side, you can do the inverse of that to say, well, which patients are those? I don't want to just remove it. I want to know which patients were admitted for COVID-19 admission. So you can use the inverse of that. And so we use a couple different methods. We use the CMS method, and then we also have a method to take all of the claims that we have, and as we get them, we apply those COVID rules. So this is a very helpful tool. You can know which of your patients have COVID, and you can also know which expenses are removed. And then from this screen, you can see all of your key performance indicators, with the COVID patients removed from the COVID admissions removed from the appropriate months. And I'm happy to answer any questions in the chat and at the end. Next slide. So here's our trend. This is a total per member per year expense for the ACO. So you can see we have a set 10,000. The black square towards the middle on the gray line is the ACO benchmark. And you can see that each quarter from we started in 2016, 2017, and 2018, which are the benchmark years. And we have quarter 1, quarter 2, and quarter 3 of this year. And you can see that in the first quarter, that trend was going way up. But then that trend starts going down in the second and third quarter. Now, keep in mind that the blue line, that's all the ACOs across the country. That's our national kind of, not really our benchmark, but it's to look at the macro trends on what's going on in all the ACOs across the country. And the orange line is doctors ACO, and you're going to see a few more slides like this. But you can see that these two lines converge. And one thing that we want to make sure of is that Medicare adjusts the ACO benchmark each year based upon the growth rate. Well, if Medicare is removing all of these COVID expenses, is that going to positively or negatively affect our growth rate? Well, it's actually going to drop the growth rate, which is going to drop our benchmark. And if we're on trend with the same line as all the ACOs across the country, we're not going to make a difference. We're not going to bend the cost curve. We're just going to follow the macro trends of what's going on in the industry. So what we want to see is the orange line dipping at a higher slope than the negative slope versus the blue line. And so right now they're kind of converging. So we're treading water a little bit. That's not going to take away from our 6.6 million. That's I already accounted for all of that into the calculations before. Next slide. Okay, so these are the component expenditures. Where are we saving money? The last column, you can see the gain and loss versus the benchmark. You can see that hospital, we're saving 2.2 million. From short-term acute care, that's the 1.8 million in savings. So it's really important that we're going against unnecessary admissions and unnecessarily hospital provided services. We're saving in nursing homes. We're also saving on imaging and lab tests. Ambulance is down, which is good. We're doing a much better job on hospice. We're saving about $1 million on hospice patients, which is appropriate use of hospice. And we want to just make sure that we continue these trends. Part B drugs and some of these expenses are out of our control, but if you look at everything holistically for the total cost of care, the net gain, we're saving about $9 million, which again would be 6.6 to the ACO. Next slide, please. So here's a great example of one thing that's very important to the ACO is emergency room visits per 1,000 patients. And you can see that doctors ACO, the orange line, is above all of the Medicare ACOs across the country. If we can get our emergency room visits below the blue line, wow, that's a win. That's going to be a huge win for the ACO. And so right now we're not there, but this December is a very important time to look at your ED frequent flyer list, make sure that your patients have access, proactive outreach to patients that are ED frequent flyers and make sure that they have what they need. See if they need to come in for a visit, see how they're feeling. Patients really love to hear from the doctor, just doctors that they care. And Dr. So-and-so is worried about you and wants to see how you're doing. So can you go to the next slide, please? So what I did was, well, who's contributing to this? So you can see here from the Athens pod, emergency department visits per 1,000. Our goal is less than 600. Athens Family Medicine, TMB Medical Associates, everybody in green, you can see these numbers are below 600 per 1,000, excellent numbers. And we also can see some of the practices that have higher ED visits per 1,000. And that's something that we need to look out for. Who are these patients contributing to this? How can we prevent those patients from going to the emergency room unnecessarily and perhaps getting admitted to the hospital, and then the specialists will have access to the patient, trying to do consults and follow-ups, and then the patient's bedridden for days and ends up being discharged to a nursing home and then home health. And all of a sudden, the patient's expense spirals out of control, all because we had to look in at the emergency department and find out who these patients are and what can we do, how can we divert them back to the practice instead of an emergency department visit. Next slide, please. Atlanta pod, you can see East Metro Internal Medicine, Atlanta Prime Med, any practice less than 600 per 1,000 is in green. And then you can see where you stand if you're above 600 in pink. So just know where you stand. We want you to know where you stand. We want you to work with your provider rep so that we can provide the reports to you. Care Tracker is an excellent way to look at the emergency room frequent flyers, to learn at high-risk patients. It's a great tool to use. So I encourage all the practices, if you don't have access, please get access to this and really use it to your advantage, especially during these last few weeks of the year. Next slide, please. The Columbus pod. So you can see your numbers, we want to be below 600. Here's our beloved Columbus pod, our newbies. We're working very hard with them and we'll continue to work so, transforming the practices into the new healthcare paradigm. Next slide. Ohio and Indiana, same thing. You can see where you want to be. You want to be below 600. If you're in between 6 and 650, you're in the yellow. And then above 650, you're going to be in the pink. Okay, next slide. All right, so our biggest, one of our big metrics are, of our $10,000 benchmark, $11,000 benchmark, about 3,000 of that goes to the hospitals. And so that's what we look at. And you can see that doctors ACO in this chart is actually the blue line, and it's going down the same as like the macro trend. So we're not really bending the cost curve relative to all the ACOs across the country, but we do have a lower starting point with those ACOs. And so which practices are contributing? So this is at the ACO level, and then all the individual practices and pods are contributing to this number. So let's take a look at the next slide to see which practices are contributing at what level. I also put in readmission rates as well. Next slide. Thank you. Okay, so here we are in the Athens pod now. I want to point out a couple of things. So our hospital admissions goal is anything less than 300 admits per 1,000, and the readmissions rate goal is less than 13%. And you can see here that, one phenomenon that I noticed is that because practices have less hospital admissions because patients are, let's say, avoiding elective procedures and avoiding the hospital at all costs, that lowers the denominator for readmissions. The readmission rate is simply the number of readmissions divided by total admissions. So you can see Madison Family Medicine, a little high on the inpatient per thousand. We want to be at about 300 or below, but the readmission rate is about 4.4%. So you can see that even though, let's say, Athens Heart Center at the bottom has 202 per thousand, one of the best numbers, but a very low denominator. And I know Athens Heart Center has a very, as a cardiologist, can have some very sick patients. So you can see that, the readmission rate may be a little higher than desired, but the denominator is lower. So what I would suspect, and Blue Sky will tell you who these patients are, is that there's patients being readmitted multiple times because they have very complicated conditions. Next slide, please. Here's our Atlanta pod, Atlanta Prime Med, 0 readmissions, East Metro, Duluth, New Horizons. These are excellent, excellent numbers. And you can see we do have a lot of work to do with some of the readmission rates. So we encourage post-discharge visit, TCMs. We're part of Patient Ping, Blue Sky, and the Doctor's ACO phone app will get these alerts right to your phone. So once the patient's discharged, it should trigger, post-discharge transitional care management visits as well. Next slide. The Columbus pod, hospital admissions per thousand and readmission rate. So you can see right here where you stand. We want to be below 300, and our readmissions rate goal is below 13%. Okay, next slide. And then Ohio, Indiana, a hospital admissions or readmission rate. So if you if you ever have questions about about patient paying, signing up, please reach out to your provider rep. So Brian Edwards, Rochelle Gordon, Neil Mehta, and we'll get you signed up. Okay, our nursing home and home health slides, you can see that we're kind of going against the trend here. Home health is going up, and for doctors ACO and for all the MSSP ACOs, it's going down. So that's something that we need to look at. Next slide. Ambulance. So one thing that we have been constantly working on is doctors ACO is 215% the national average for ambulance visits. So we want to work on this number and make sure that patients are appropriately using ambulance, not calling the ambulance to get a ride, for a doctor visit or something like that. Next slide. And then same with hospice. Even though our hospice numbers are way down from where they started, we're still about 150% the average. So consider, I know Dr. Plaster's here, so please consider the provider outreach patient, and we can provide reports that will have options or potential candidates for physician outreach. Next slide. So crunch time, there's 4 more weeks left. Use Care Tracker for ED frequent flyers. We have annual wellness visit module. Keep those healthy patients assigned to the ACO as well. Get them in for preventative services. Try to send 5 to 10 outreach referrals before the end of the year. Go through your list, work with your provider reps, and also extend holiday hours and ensure access during these, these can be very stressful times for patients. Okay, thank you very much. Finish strong.